Hello, it's Saturday morning. I don't know, it's about 7 o'clock. Um, this is my when I come home, don't bother me chair. So, sometimes you guys don't see me sitting in this chair. But I wanted to come on and talk about, self-pay patients. And again, motivation to everybody. We got to do what we got to do, try to help everybody as much as we can and do what we can do to contribute. Um, I don't hear on the news people talking about bills. Uh, at this point right now, the medical insurance billing and the coding is going to be massive. Um, the test is free. The test is free, but the care is not free. The care is not free. The facilities are going to have bulk charges, massive bills, Medicare, Medicaid, commercial. I don't care what it is. The bills are going to be dropping. It takes about maybe 3 days possibly for a bill to drop, depending on the capacity of people that you have working. Now, we work in a hospital, and the lockdown is not for the hospital. The lockdown is not for us. We have to come in. The bills have to be worked. The bills have to be run. You can't just, the billers and the coders can't be home when all these bills are dropping. They got to circulate the front end and the back end. Now they got to work together, which they do all the time anyway. But everything is coordinated. It can't be no layoffs or nothing like that because the hospitals need everybody that they have. But people, their medical insurance has to start kicking in because some people are going to the facility for symptoms, signs and symptoms of the, the virus. But they're finding other things wrong with these patients. So it's not like this, they're just going in there and it's just, they're checking for the what's face. That's how I talk, you can't say the C word, But you guys know what I'm talking about. The patients are going in there, which is good because you're supposed to have your yearly check. And, and some people don't. Some people don't even do their yearly check. It's like, 2-3 years. All right, I'll be there. And then it's late. People are getting checked now. Doctors are finding other stuff. I don't hear that. Now, we as the billers, we dropping. And you're supposed to stay in your lane. But you see the bills, you see the codes, you see the so-and-so. And you're like, it's confidentiality. You're not supposed to express anything. But my worry is that a lot of these patients are going to be self-pay. Number one, if you don't have insurance and you're coming to the facility, they try to put you on like a FAP type of thing, like an assistant payment thing. You make a payment plan or something like that. But in many cases, even if, insurance companies, I mean, this is what I'm saying. I don't hear the federal government talking about how they're going to work with the insurance companies, how they're going to help them, get these people's claims paid, because there's going to be millions of people that are going into these facilities and they don't have insurance. Many of these people going into these facilities and they only have a certain type of insurance. There's certain plans. They got to pay these deductibles and this and that. Deductible $500. We're letting them in. We just bill them. The deductible if anything. If not, they have to be billed. If they don't have it. So you talking about some people come in. They got to have emergency surgeries. They find this. They find that. You just never know what you may find. But like I said, in the medical billing coding type of industry, it is what it is. It's no slowdown for us. We still got to do what we got to do. But patients, have, self-pay. If it is the insurance, we have fee schedules. They may be required to pay 50% of the charges, 15%. Medicaid, it's like, 10%, or, you might have a bill for $10,000 and Medicaid is paying $300. That's what we're taking. But if the patients, don't have insurance, there's no adjustment. You're billing the patient for $10,000. So, you have to be precarious, whether the patient has, Medicaid or whatever, you still, make sure it's good. If y'all got that type of insurance or whatever, make sure that it is good. Make sure it's not terminated because right now you need that insurance. The self-pay companies, they're going to be working hard. They're going to be working hard because the facilities have to get paid. I'm not saying that the facilities are here to benefit, because they taking a hit. They're taking a hit on the patients. They're taking a hit on the supplies. But in the end, they going to take a plus on the revenue, because the revenue for the facilities is getting ready to shoot, because those bills are going to be dropping. You know what I'm saying? It's my job to make sure that money comes in. You know, I deal with, the out-of-state Medicaid, Medicare. They got to come in. You know what I'm saying? The other part, they do commercial. I do Medicare and Medicaid. We got to make sure that money is coming in. If that patient does not have insurance, the patient is not in effect, the insurance was terminated before time. I mean, we have financial counsels that's going to help patients to, try to see if we can get this thing backdated, and hopefully everything will be backdated for Medicaid. If your Medicaid lapsed or anything like that, we can get it. We can, assist in trying to get it up to par. But for those who don't, you have people who are, not citizens. They need to be looked at too. Those are going to be bills and stuff. So, I hear a lot. I'm on CNN all the time. Y'all know I told y'all I'm like a CNN junkie, but I don't know what we would do for the self-pay patients. Now, I got to drop the bill. It don't even matter. I mean, we're going to investigate, make sure it's not no code issue, make sure, certain things. Sometimes you're seeing like that Medicaid managed care, sometimes the like Health First or United Healthcare. People have regular Health First and United Healthcare that they pay into, but Medicaid, since they have the managed care, it's like a combination, and sometimes you drop to the incorrect one. You drop to the straight commercial when it should have went to the Medicaid first. You got to do Medicaid first, and then they'll send it over to the commercial. You know that Medicaid MCO that what Obama had put in place, but that's still going on. But as far as billing, that's a part of billing. I don't talk about billing much, but right now I'm talking about billing. And the billing is within the code, and it's all, it's all intertwined together. But, I definitely encourage people to go to get themselves checked out, whether it's for the virus or not. You still need to go check and see, what's good. But when they go in for the, for the issues, they finding other stuff. So let's think about that. I mean, all those people, they're gonna have all those bills. And trust me, if you don't pay your self-pay bill, we put you in collection. You're gonna be in collection department. Lord knows that's 7 years. And you still have to pay. You still have to pay. So, that's the billers are working overtime. I'm saying it ain't hit yet, because when I went to work, yesterday, a couple of people is out, but you're talking about the managers. I mean, this is the manager perspective. I'm telling you right now, we're going to take a major hit. It's not just little things or little things here, little things here. It's a lot. The healthcare system is going to be overwhelmed. Not only do they already have a shortage of the nurses. I mean, you calling people in. Shoot, I almost went over there with my little nursing assistant certificate. But I'll just say it, like, you want to try to do something to assist and help. Even if you're just giving out tests, I don't know. I'm here on Saturday and Sunday. I might try to do something like that on the weekends. I don't know if they take me, if they let me do it and use my certificate. It ain't certified no more. It's been expired. But if you got something and you can contribute, just ask them, can we do this? What can I do? You know what I'm saying? But as far as the billing is concerned, the billing is getting ready to go radical. It's about to go down in the billing. Like I said, the test is free, but the care is not. So I'm 9 minutes in. I just wanted to do a quickie, even though today I'm supposed to be talking about ICD-10 and stuff. But again, this is about ICD-10. I mean, this is billing. It don't make a difference. It's still billing. I'm going to have my coffee and stuff now, but I just want y'all to kind of be precarious about the billing and the coding and what's getting ready to go down. We're going to get an overload too. And we got to make sure that stuff is flowing and it's not backing up. I mean, it's a lot in the healthcare industry to not only, keep the revenue cycle going. That's what this is. There's a revenue cycle, the front end, the back end, the financial counselors, you know, the billers, the coders, commercial claims, Medicaid, Medicare, and then not to mention the claims that we already have that we're still working on. What we have now prior to this is nothing against what we getting ready to have in a week or two. Because once those girls drop, those just whole different department charges. You got girls in there that dropping them charges quick. 2 weeks, 3 weeks, you talking about charges up the wall. Like I said, you know, the test is free, but them hospital stays and observation, and I'm telling you, it's getting ready to go down in the building. But I'm gonna put this on Facebook. Y'all know I'm gonna put it on YouTube. Just, you know, kind of be precarious of that. Again, y'all can, you know, go in the classroom, but you can look at my YouTubes. I talk enough about billing and coding and stuff like that. I don't do physical stuff. You guys don't see none of the stuff that's in the classroom, but look at the videos. You can see a lot of this billing stuff. But again, you know, you can do this at home, but there are some, you know, facilities that don't do it, you know, at home. You still have to go in certain aspects. So, you know, it is what it is. It is what it is. You guys got any questions? Don't forget to email me at llbcfink at sapphirefinancialtraining.co. Send me an email. Go on YouTube, Facebook, you know, go on my website, whatever you want to do. And subscribe. I promised them I will say, and subscribe to my channel. Okay. I'm small now, but I'm about to blow up. I know. But anyway, we're going to get there. But, you know, as I think of stuff that's going on, what's going on in this social society right now with this crazy thing, the medical billing and the coding is getting ready to, we can work. We can work for real. Not that we weren't working already, but I think that right now, respect to all the billers and coders. Respect to all of y'all, because they need us. They need us. Because we've got to help them. And this is a health society. We got to help them. All right, I'm about to get off. I might be on later on, but I got to figure out what we're going to talk about. But I got to work on the files for y'all. So talk to you later.